Yes, guys, at least at long last I'm here. Yesterday we did not have any class because I was so tight and I could not make it to come. But today I've managed and we are still continuing with the topic called anemia. Hmm? We saw anemia is low red blood cells, hemoglobin levels, red blood cells that are low in your body. But we saw there are several types of anemia, and today we are dealing with anemia that comes because of the size of the red blood cells, the distribution of the red blood cells. We should right now check on how these types of anemia come, and we analyze and categorize them. So when you hear there are some words I want to put out, there are some words I want to put out, and these words are very important when it comes to the topic anemia. One, the word is called macro. Macro, when you hear about macro, you know it is big. Hmm? When you hear about macro, you know it is big. When you hear about micro, you know it is small size. When you hear about normal, you know it is normal, you know it is what? It is normal size, because your cells can be normal size but you still have anemia. You see, so there are so many things that we are going to learn today about the size of anemia that comes because of the size of the red blood cell. And here we are talking about these things. We are talking about normocytic anemia, macrocytic anemia, and microcytic anemia. So we check these things categorically. We will start by something called minute. I do 1, 2, 3 here. You know, sometimes when you come online, you have to stabilize. I can see the Mekan uncle already had logged in. Mm. Okay, let's see. I'm receiving several messages. I'm reading several messages here, telling me, okay, telling me that there are some questions I'm receiving, and I'll get them so fast so that we see what to do. What to do? Yes, yes, yes. Try. See this one. Let's see. 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 This other. Hmm. Let's see this other one. Let's see this other one. Yes, yes, yes. See that. Good. Now we see. We start with macrocytic anemia. What is macrocytic anemia? Macrocytic anemia is a type of anemia where the red blood cells are larger than normal. It identifies the mean capsular volume is above 100. Length, the size is above 100. You see, if the normal is, let me draw something here. If the normal is this one, the small one, say, and then it becomes bigger, this can be a problem. You see, so the normal size of, from the normal size, and it becomes bigger. So when I'm talking about mean capsular volume, what am I saying? I'm only meaning the volume of the red blood cell. Now, what are types of anemia that can come from macro, eh? Where when they are bigger? If imagine you have big hemoglobins that are not helping you. You have big hemoglobins that are not helping you, because let's say in a volume like this one, when I look at a microscope, this is my volume here. This is my volume. And I have 1, 2, 3, 4, and 5. But here I have another the same volume, which I have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So let's say this picture of mine, you see, let's say this is the bigger one, and this one are the normal. So the big and the normal. So these are my red blood cells. You see, these are the bigger ones, and this ones the normal. So if these are the bigger ones and these ones are the normal, you see this one will, the normal ones will carry more oxygen, but the smaller ones will, this one, the bigger one will carry less oxygen, and this one will carry more oxygen. So that is what means megaloblastic anemia. You get it? So we continue here and say there are types of problems that can bring this problem called megaloblastic anemia. Types of macrocytic anemia. What are the types of macrocytic anemia? We have megaloblastic macrocytic anemia, occurs in impairment of DNA synthesis, leading to abnormal RBCs production. So when your DNA is being synthesized, it produces some abnormal RBS. You see, main causes are vitamin B deficiency, folate deficiency, and certain drugs like methotrexate and phenytoin. So if you have a deficiency of B and folate deficiency, and some drugs you're taking like methotrexate that are used in some problems, you may get this problem. And then we have large immature RBCs. You have just big red blood cells, but they are immature. You get it? Hypersegmented neutrophils. Neutrophils that are hyper, they have segments in them. You get it? And may have neurological symptoms, especially in B12 synthesis. You see, when I'm saying about neurological symptoms, it means nervous problems. Burning sensation, we call them paresthesia, and neuropathy, you burning on your feet. Non-megaloblastic microcytic anemia. You see, those that are non-megaloblastic, megaloblastic means they are immune mediated, they come from your immunity, or you have less, how can I put it, you have less nutrients that helps these cells to grow up. We call them megaloblastic. So those that are non-megaloblastic, they are not immune mediated, are like liver diseases, a problem that is bringing you having this problem. They have alcohol use of alcohol every time until you start producing. You see, alcohol sometimes interferes with B12 synthesis in your body. Hypothyroidism. Hypothyroidism. Hypothyroid. You are not able to control the release of some hormones like erythropoietin. Bone marrow disorders. When you have bone marrow disorders that are making you not producing the good red cells, increased reticulocytes, e.g., blood loss or hemolysis. When you are losing blood every time, see, you will get some signs and symptoms like fatigue, weakness, shortness of breath, and paleness. Sometimes you become just pale. And specific features, sometimes you'll find you have numbness, tingling sensation, difficulty in walking, and memory problems. So when you start having these problems like the numbness and neuropathy, the pain, I usually say neuropathy that burns on your toes and fingers and where, just know you have problems, and this problem is nutritional. You don't have vitamin B12, that is enough. So you better, if it is so, you could go to a doctor. If it's so down, you will be injected with vitamin B, and then you will be okay. Folate deficient, the glossitis. Sometimes when people have glossitis, it means your tongue is swollen. swollen. Now, there are some investigations like full blood count that will show us high mean capsular volume. You have big red blood cell, peripheral blood smear, vitamin B12 and folate levels, liver function test to show if, and we can take even bilirubin levels. Bilirubin comes from broken red blood cells. So when we check the bilirubin levels and we see it's high, we know there is a problem, and this problem is maybe some things are interfering with your red blood cells. We have the thyroid function, we have bone marrow aspirations. You see, there's so many tests that we can do. Yeah, in management depends with the cause. So if we have done iron studies like ferritin, we have done the full hemogram, we have done the peripheral blood smear, the thyroid hormone, and then we determine that you have a deficiency in B12. That is when we do what? We do what? We come in and take and replace or treat you. If you have iron deficiency, we do what? We replace the iron. Now that is about uh, megaloblastic anemia and non-megaloblastic anemia, macrocytic anemia. You see, in microcytic anemia, we are dealing with two types: megaloblastic and non-megaloblastic. Macro, big, eh? And common causes when it comes to megaloblastic, it is deficiency in vitamin B12, folate deficiency, and certain drugs. You see, this is where you get megaloblasts that are immature, cells that are immature. So when I'm talking about megaloblastic, I'm talking about the cells that bring out the red blood cells. And then we have non-megaloblastic, which are come as a result of alcohol abuse, liver diseases, hypothyroidism, bone marrow, disorders, and increased reticulocyte count. You see, signs and symptoms, sometimes all of them, they share fatigue, weakness, shortness of breath, and paleness. So between megaloblastic means the cells that produce white blood cells, and non-megaloblastic, you can only find out by doing the laboratory tests and some imagings to find out. But the symptoms of this, all of them, they share fatigue, weakness, shortness of breath, and paleness. They share all this. Now, if we go to there is the other one, to microcytic. We have said microcytic macrocytic means smaller, small. Microcytic anemia is a type of anemia where red blood cells are smaller than normal. Imagine they are small. And it's diagnosed when mean capsular volume is less than 80 ml. They are small. The volume is small. So when they are small, what happens? What do you think happens when what do you think happens when these things? Wait a minute. When they are small, where do we get these problems? How do we get these problems when they are small? Common causes like iron deficiency, poor eating habits. You see, sometimes iron comes from the foods you eat. So when you are having iron deficiency, occurs when the body lacks enough iron. What will it come? You will have anemia, microcytic, small that is red. Yes, 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 yes. Alikuja. Yeah. She's next week. On Monday, Tuesday. Yes, yes, up to Sunday. Yeah. Acha tuongee, I'm doing something. Okay. Now we were talking. Uncle is in the house. I'm seeing Jamaican uncle in the house, Uncle, welcome, welcome. We have gone to the second one, which is microcytic anemia. Micro, smaller. You have a deficiency in some foods that you eat. You don't have enough iron, and then your red blood cells become small. And if you see, uh, if you look at the causes, you will see poor diet, chronic blood loss, heavy menstruation, which comes when women, and then some people have ulcers. They don't know they are bleeding from ulcers, because when it is digested, it comes out of as stool. And when it comes out as stool, they don't differentiate between normal stool and the stool that is digested from blood. And then there is some intestinal parasite. You eat food from the streets, you get parasites, they start eating your body. Some parasites like hookworm, and the parasites that cause dysentery, you start having problems, and then you lose the capacity of your 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 red blood cells to become normal, so they grow up weak. You see, this is called iron deficiency. Micro is small, so iron deficiency because of small red blood cells that cannot carry oxygen that is enough. We have poor absorption, intestinal diseases, poor absorption. You eat food but you don't absorb iron. There are some diseases that makes a person not to absorb iron well. And then there are some things when it comes to microcytic. We say thalassemias. When you hear a doctor talking about thalassemias, just know you are talking about disorders caused genetic disorders. Genetic disorders often runs in families. Like you can find NBC's count may be normal or high despite anemia. You have normal RBCs, but they are high despite having anemia. You get it? So this is the problems that we face, common in some population worldwide. And then we have anemia of chronic diseases. Anemia, we are dealing with anemia. Here we are at micro, small anemias, small red blood cells. Sometimes you get some people that get chronic infections, cancers, chronic inflammation, and diseases. You see, these are the problems. And then we go to the fourth one, which is called sideroblastic anemia. Occurs when iron present but cannot be properly used to make hemoglobin. People that take alcohol. You have iron, but the iron you have, it being destroyed, it cannot create hemoglobin. Just imagine. Drugs like methotrexate, we have already talked about methotrexate. And then we have bone marrow disorders. Bone marrow, in your marrow where the megaloblasts are, the cells that come out to produce good red blood cells, there is a problem. Lead poisoning that destroys the megaloblast. Megaloblasts are the cells. Signs and symptoms are always the same: fatigue, weakness, shortness of breath, and pale skin. Imagine. Specific features in iron deficiency: brittled nails. When you see your nails are brittled, spoon-shaped nails, koilonychia, craving non-food, speaker, and so on. You are craving. You have seen some women when they are pregnant, they always like eating even soy because of lack of iron. That is called compensatory. The baby is growing, the mother still needs the iron, so the iron stores are low. You get it? So it's compensatory. That's why we put women on iron supplements and folate. You get it? And folate helps to bring up the baby, and when comes to embryology, the baby to grow up well. Now, the studies that you can do here are called full blood count. That is normal, you understand it. Low MCV, mean capsular volume is low. We are talking about low MCV. You have red blood cells that are small and smaller. They cannot carry oxygen well. We have serum studies, ferritin levels, hemoglobin erythropoiesis. So when it comes to thalassemia, genetic disorders, we do something called, when your family has genetic disorders like sickle cells, the people that have sickle cell, we do something called erythropoiesis. We study the with hemoglobin, we study the red blood cells and how they are growing so that we can know what is the problem that is coming out. So in small microcytic anemia, where we come to small hemoglobins, iron deficiency, iron supplements, treat source of, like you see, we give iron if it is iron deficiency. If it is thalassemias, which are genetic, some things you cannot treat. You monitor and transfuse blood when it is severe, in severe cases. You see, genetic disorder, treating them means you go to the lab and discuss so keenly, and there are some that you cannot treat, you can only manage. So if it is thalassemias, what we do, we give blood and monitor, and we continue with life. See, sideroblastic anemia, treat the cause. Sometimes it's vitamin B6. B6, just treat the cause. You see, but there is a certain kind of anemia which is called normocytic. So we have said normal means normal. Normal. Normal anemia is a type of normocytic anemia is a type of anemia whereby red blood cells are normal in size, but their number is reduced. It's diagnosed when mean capsular volume is between 80 and 100. This one can come, you have normal red blood cells, but reduced in number. So they are not giving enough oxygen because most of them must give oxygen that is in particular levels. So here is where you get trauma. Someone has bled and then he doesn't have enough red blood cells, the hemoglobin. And or you have taken someone to surgery and it has taken long, so this person is having low, because when you are doing surgery, you are cutting between some blood capillaries and blood is flowing out. You see, intestinal bleeding, the ulcers, peptic ulcers, and some diseases that are caused by hookworms. Those are parasites. That's why I'm saying when you are used to eating foods around the street, please don't. Anemia of chronic diseases, the second one. See, now we are dealing with a hemoglobin that is normal, but it's not giving you enough oxygen because it cannot carry the required capacity. You get it? Now here, anemia of chronic diseases like kidney diseases. Why kidney diseases? It's because the kidney produces erythropoietin, which is essential for production of megaloblasts so that they can mature to red blood cells. That hormone, if you don't have it, you will have anemia. We have chronic infections. You get chronic infections until you cannot even have enough good diet. The infections you have, they are destroying B12 absorption. Even your megaloblasts are being destroyed. Cancers, AIDS, chronic inflammation and conditions. You see, these are the problems that we really need to check out and follow when it comes to anemias, that are, you have normal blood cells, hemoglobin, but you cannot use them properly. They cannot give you oxygen that is required. Chronic inflammation and condition. Yes. Now we go to hemolytic anemia. So now, when you hear about hemolytic anemia, you know hemolysis. You need to know lysis means, lytic means destroyed, destruction, malaria. The parasite gets inside the red blood cell, then it destroys it. So you get to anemia. Autoimmune diseases, sickle cell disease, certain drugs. There are some drugs that you take, they interfere. Yes, welcome Doreen Small. We are talking about anemia today. Some certain drugs you take, they destroy the red blood cells. The people that are so for therapies for long, like ARTs. ARTs are meaning antiretrovirals when they are being metabolized in the kidneys and they feel the liver, and they are so heavy. TB drugs. You remember TB drugs, the pyrazinamide, ethambutol, isoniazid, those drugs, they may make you have anemia because they are destroying the red blood cells. Remember, we are dealing with Normocytic anemia. You have normal red blood cells, but they are not enough. This is the third part of it. And then we have bone marrow disorders. Remember, we have said common causes of Normocytic anemia. The blood cell is normal, but now you have acute blood loss. And then we have anemia of chronic diseases that like kidney, that is the second one, chronic infections, cancers, and chronic inflammation conditions. Then here we have something called hemolytic anemia. Hemolytic. I've said lytic means destruction. So here we are dealing with something that is destroying the red blood cell, like malaria parasite, autoimmune diseases, sickle cell diseases, certain drugs that I've mentioned. But at last, the fourth, we have another one which is called bone marrow disorders, megaloblasts. The cells that are called the megaloblasts are cells that are produced from the bone marrow, that when they grow and they come mature, they form the red blood cells. But these cells are found in your long bones, in the marrows. Bone marrow is between the bone. You see, this bone, sometimes it's good to, sometimes it is very good to make people understand, because I may feel maybe someone knows where the bone marrow is, but this person doesn't know where the bone marrow is, you see. So let me draw this bone here and show you where the megaloblasts are. Now this is my femur. Femur is the bone of the foot. So this part, this is called the bone marrow. So inside the bone marrow is where the megaloblast, the cells that blast and come out and make the red blood cells are. But imagine, if someone interferes with the formation of the megaloblasts, which are the cells that come and form the red blood cells, what will happen? What will happen is this: you will have anemia, bone marrow disorders. People that have leukemia comes from this, the bone marrow disorder, the leukemia. And then we have aplastic anemia. These are things that we will discuss in depth. Now, at least, big up to you, my second doctor and bodyguard, Mawira. Go and everyone who is in the platform and listening, Mawira does some good things. Follow that channel, only Mawira. You will see things that Mawira does. Very nice. Yeah? And when it comes to mental stability, Mawira will sing for you a love song and then you are okay. That is nice. That is nice. And then hello Benjamin and everyone listening from the back and haven't had an headache. Haven't a headache. Oh, it's okay, Mercy. It's okay. Don't worry. When we want advice, we go to our top one, our uncle himself, Jamaican uncle. But when you want medical advice, you drop to your brother here, Benjamin, the wise guy. Cool. Let's go on. We talk about aplastic anemia. What is aplastic anemia? We'll see. I know everyone knows about leukemia. It is a topic of the year. Now everyone knows that megaloblasts, this is your femur, bone of your feet. So the megaloblasts are cells and they come from the bone marrow. And when the bone marrow has issues, you have a problem called anemia. But you see, if we stop it from having that problem, you'll have normal cells. So aplastic anemia is serious blood disorder whereby the bone marrow fails to produce enough blood cells enough. I know leukemia as a blood cancer. How wrong am I? Mawir, it is cancer, and leukemia is a cancer that comes from the bone marrow. Your bone marrow produces cells that come out with leukemia. You see, we have said in the fourth one, bone marrow disorders, it brings aplastic anemia. Aplastic anemia is anemia whereby bone marrow fails to produce enough uh, red blood cells. So leukemia is cancer, is a cancer, and this leukemia is a cancer of the bone marrow where abnormal white blood cells are produced in large numbers. And you see, when you have them in large numbers, it will be a problem. And you know, it is a problem that comes from the bone marrow. So today we are categorizing these problems, and then we will start to dig to them one by one. We will come to leukemia. We see if the white blood cells are produced in large numbers, what effects do they have in your body? You see, and then we have the third one, which is called myelofibrosis. You see, just as leukemia and the less numbers where we call megaloblastic, we have this called myelofibrosis. It comes from the bone marrow, the bone marrow. And what is myelofibrosis? Myelofibrosis is a chronic bone marrow disorder where normal bone marrow is gradually replaced by fibrous tissue. Now, this bone marrow should be active and live, but this bone marrow should not, it should not become a tissue, because if it becomes a tissue, a fibrous tissue, it will lose its job of producing the megaloblasts, the cells that we want them to grow to be red blood cells. So in category of bone marrow disorders that gives us anemia, we have aplastic anemia. Aplastic anemia means more or less cells are produced. Leukemia means your bone marrow is producing a lot of white blood cells, a lot of, it's like a programmed thing that is producing from the bone marrow. And then we have myelofibrosis. Myelofibrosis means the bone marrow has turned into a fibrous tissue, so it is not doing its work. It is not producing the cells that are supposed to give us the red blood cells. You see, even bone marrow disorder can give us problems. Bone marrow disorder can give us problems. And then here we have a very important one that we cannot leave aside. What this important thing that we cannot leave aside? Kidney issues. Kidney issues. Reduced production of a hormone called erythropoietin, a hormone that stimulates our red blood cell production. You know, when your red blood cells go down, your kidneys come and check and check and check and check and it says, no, the red blood cells are not enough and they are going down. What can we do? It releases something called erythropoietin in blood. Imagine, the kidney senses and it releases this thing called erythropoietin, which is a hormone in blood. So it goes up to the bone marrow and it stimulates the production of the megaloblasts, those cells that now starts to grow. They grow, and then they give us red blood cells. So if you have a person who has a kidney injury, just know that person can have an anemia. And you have ever nursed a person with kidney injury, always you will find that this person will suffer from anemia, because the kidney is injured, it's not able to produce this person, this good thing that is called, this hormone that is called erythropoietin. But I've said the symptoms of all anemias, all symptoms, I have like 10 minutes. If anyone in the platform has a question, please ask. Just ask any question as we go on, because I only have 10 minutes and I'm summarizing. If you have any type of anemia, you will have fatigue, weakness, and then we'll have shortness of breath, pale skin. And when we are dealing with distraction, we'll have jaundice, hemolysis. Jaundice means you've seen a person who is suffering from malaria. The eyes are yellow and the palms are yellow. So this person, when the parasite are destroying the red blood cells, destroying, they enter between, they destroy. It becomes hem, and globin, and the hem itself has bilirubin and iron. So the bilirubin is yellow. That's it comes to sediment into your eyes and palms. So that is the yellowness that we see because of destruction of by the malaria parasite. Bleeding signs, blood loss, recurrent infections. You see now, that is a very important thing. Investigations, we have said. Now, before I go, if anyone has a question, please bring it down. If you have an experience, tell us so that we see. Before I go, I want to repeat this. Which is very important. Today we have learned about macrocytic anemia. Big. You have macro, big anemia, and we have dealt with megaloblastic macrocytic anemia. Big anemias because of deficiency of B12 and folate deficiencies. We have dealt with that. We have come to non-megaloblastic. When we talk about macro, you know it's big. We have dealt with non-megaloblastic. It is not about the cells. It's not about the cells that the megaloblasts of the hemoglobin. It's about your lifestyle. Liver diseases that is caused by alcohol use, hyperthyroidism. Yes, Leila is in the house. Welcome. Bone marrow disorders. Those ones we have talked about. Common causes of. So in in macrocytic anemia, we have talked about two. The one that is not big and the one that is big. And then we have gone to signs and symptoms. You have said all they share. So when we came from macrocytic anemia, where did we go? We went to micro. So macro, big. You are producing big red blood cells. And we have said they are categorized in non and micro, megaloblastic and non-megaloblastic. Where you yourself, you take alcohol, they destroy the cells that are bringing. Now, we went to the second part, whereby we have micro. Is age a factor to be considered when it becomes the disease exposure? Yes. Mawira, that is correct. Because if someone, as a person grows, some factors reduce. A person who is 24 years and a person who is 48 years, the person who is 24, the kidneys are very active and they are producing enough erythropoietin, the hormone that stimulates production. But a person who is 40, the hormone has started reducing. To 60, it has reduced. That's why some older generations, people, you will find they have low blood count. That is correct, Mawira. It's very correct. And then now we continue. We went to the second part, micro. I'm finishing. Please bring the questions. Bring the questions. We went to the second. Micro, we said they're small. You are producing red blood cells that are small. And what have we said about it? We have said this. When you don't have, you have enough to eat iron, you can get it. So your red blood cells are weak. You don't have enough nutritional care and they are being small. Poor diet, iron intake. You don't like taking greens, you don't like taking broccoli. You always take bad things like cholesterol-rich foods, junk food. You will get anemia. I feel like I'm in a Leila is saying he feels like he's in a biology class. Yes, we are in a biology class. Biology is everywhere. Biology is everywhere, at home, here, at the church. Yeah? That's why we are interacting biologically. Now, we have talked about small red blood cells. I want people to understand that blood volume is not, after this class, we qualify to open a chemist. Mahira is saying after this class he'll open a chemist and then you'll be caught by Pharmacy and Poisons Board. You have to get the license so that you sell the drugs. You go to school, you are trained. Medicine is wide, and that's why we have pharmacists, we have doctors, we have clinical officers, we have nurses. Every person has his job. No, to small, to those, the ones that we have said smaller, the small ones, my time is going out. The small ones is poor diet, chronic loss of blood, increasing, Leila, greetings to you, increasing demand, pregnancy, growth in children. I've explained, just start. If you've come in the middle, you start from the beginning. You'll know how pregnancy causes low blood, the hemoglobin, the red blood cells that are smaller. Poor absorption. You don't absorb nutrients well. And then we have talked about thalassemias, genetic disorders like sickle cell, leukemias. We have talked about them. And then anemia of chronic diseases, cancers. We have talked about them. Sideroblastic anemia occurs when iron is present but cannot be properly used to make hemoglobin. And then we have causes like alcohol use. Signs and symptoms of all is fatigue, weakness, shortness of breath, and paleness. You feel fatigued, always weakness, shortness of breath. Sometimes you cannot or you breathe faster for compensation so that your brain can get oxygen faster. Pale skin. But when it comes to distraction, when it comes to distraction, what happens? You will have jaundice. I've said jaundice is yellowness because when red blood cells are being destroyed, you get heme and globin. Globin is the protein. Heme is iron plus bilirubin. So bilirubin is the yellow part which comes on your palms, your eyes. You see, and iron remains there. And then you will have brittle nails, spoon-shaped nails, craving for foods like soils. That is it. You see, at least now you know how to categorize anemia. Tomorrow, we are going to work on another part of anemia. I'll put it as usual. And I usually come at 4:30, but questions, let questions come. I have 7 minutes. Please bring questions. At first, I come at 4:30, but sometimes how do we repair the broken red blood cell tissue? The broken, Mawira is asking, how do we repair the broken red blood cells tissue? Broken red blood cells. If a red blood cell breaks down, you cannot repair it. Blood itself is a tissue because it contains many cells, the white blood cells, platelets. But if a red blood cell broke, you cannot repair. What you need to do is to eat good so that the cells that produce red blood cells and the kidney that produce the hormone can work well to come out with, you understand? So we don't repair, we eat good food. And if you have a cancer, there is a session that is coming of cancers, the thalassemias, that we will know how to help when it comes to cancers. But when it comes to alcohol intake, people that likes the drink, you stop the drink. Yes, my baby last month lost her appetite and took a week without proper food. So I took her to the hospital, only the doctor to tell me that has anemia. It was confused until the doctor said it was not. Leila, did this doctor tell you the milligrams of hemoglobin? Did he do a hemoglobin count or a full hemogram? Because if a baby is anemic, we have to have a proof of the hemoglobin count to know how much hemoglobin level this baby has. And the other one, to the signs. Is this the baby weak? Is this baby having irritation? He said it was 10 out of 14. That was not anemia. That one is okay. That one is okay. Some babies have, that one is laughing. That was not anemic. Let me tell you one thing. Let's see normal values. We started by saying normal values of, sorry, some kids have low levels, but when they grow up, what do they do? It comes to normal. As we finish up, the normal values in adult is 13 to 17. You see, adult female, that is male, was booked before she explained that to me. So adult female is 12 to 15. Those are females. Now we go to children because Layla's is a child. Newborn is 16 to 22 because when you are born, the hemoglobin, we call it fetal hemoglobin, is high. The hemoglobin that a baby is born with, and the one that we have is different. There is fetal and there is normal. So 6 months to 6 years, you'll get between 11 to 13 grams per deciliter. 6 to 12 years, you'll get 11.5 to 15.5. So you see, having 10 to out of 14, there is no problem. This baby should eat well. The mom should, if a baby is suckling, should suckle well, and then life should continue well. So don't worry, Layla. We can take some other question. I have 3 minutes. So those are the normal values. When it is anemic, yeah, men, you have below 13 milligrams. That is anemia. Women, when you have between 12 grams per deciliter, that is anemia. That one is anemia. And a woman who is sick, who is supposed to go to theater with 9, without 9 plus, we cannot do. We have to supplement, give until it is high so that it can sustain oxygen when he's in theater. Pregnant women is 11. So you see, the doctor was a bit like that. So today we have dealt with those types of anemias, and tomorrow we have another lesson. I see the cancer thing has come out, leukemia, and I have 2 minutes. The leukemia and the thalassemias. Leila is laughing. No, don't laugh, Leila. In medicine, people learn a lot. 7 years is not a joke. 6 years is not a joke. You can be confused a little bit, but when you get advice, you are good and okay. It's good to seek advice and to study more. That's why I usually tell people, if you are a doctor, a nurse, a clinical officer, or a health worker, don't say I'm tired with books. Always study, because you are dealing with human beings. So we will start by some. We can do bone marrow aspirate to get the bone marrow, aplastic leukemia, and myelofibrosis. So everyone who has been in the chat, how many minutes? I have 2 minutes. Two. One. Anyone who has a question, please. If there is any question, I welcome it before I sign off. I sign off. By the end of those years, I think I might have forgotten the past, the first 3 years. No. That's why we should continue studying, and save life. And as I'm bringing these topics up, you see, I'm even myself refreshing, and finding out that I don't know this so that I can go and research more. So in medical field, we should study. I'm sure even some medical students follow me and they learn something. So I'm seeing there is no question, and I thank everyone that is in the platform today. Please, here I can see Mawira, Jamaican, Uncle Ridley, Marcia Thompson, all that, Doreen Small from Jamaica. Hey, my first in the travel list is Jamaica. Thank you so much for your support. As we leave, please share this. And if you don't understand something, everyone has my email address. Always email me privately. I'll keep it confidential. We interact there. May God bless everyone. Share this message. Tell them we can talk. Let's meet tomorrow at the same time, 4:30. Bless all. Good time.